We are several weeks into the new school year and time is running out to get your student updated on their vaccinations. Brooke Hamby, Public Health Nursing Supervisor for School Health at the Forsyth County Department of Health, is joining us to talk vaccines, to talk deadlines, and just talk about overall good public health. She's also taking your questions. You can text them to the number that's on your screen, 336-379-5775. All right, so Brooke, let's first talk about this because there really is a deadline. There is a time frame that if the students don't have their required immunizations, they just are told you can't come to school.
Yeah, so in the state of North Carolina, there is a law that states that kids have to have certain vaccines to come to school. And they're given a 30-day grace period from their first day of enrollment. So our first day of school was August 12th, which means that next Tuesday is our 30th day of school, which is September 10th. And then on the 11th, if they've not turned in their required immunizations or health assessments, they will be excluded from school until they get those.
Okay, so Winston-Salem, Forsyth County students, remember they went back to school a little bit earlier, so their 30 days started earlier. Guilford County schools, yours started on August the 25th, 26th when you went to school, and you've got 30 days. But again, once the 30 days are up, no matter what school district you're in, that 30 days is up. All right, so let's talk about that long list of required vaccinations because they're kind of staggered for the different grades.
It is staggered for different grades. I know that each kid is required to have DTaP or diphtheria, tetanus, and pertussis, varicella, MMR, hepatitis B, polio, and then, it's different amounts of doses depending on how old they are. Usually to go to kindergarten, they have to have 4 or 5 DTaPs, 3 hepatitis Bs, 4 polios, with one of those being after their 4th birthday, 2 MMRs, and 2 varicellas.
Yeah, we're looking at that long list right there. And I'm thinking to myself, K through, once you start kindergarten, stuff like that, you're kind of used to getting all those vaccinations and stuff. I'm imagining there are some unmemorable times to get a vaccination.
Yeah, so for parents, it's really tough to remember that, once you get your kid into school, you're kind of just in cruise zone. But when they're entering the 7th grade and when they're entering their last year of high school, their senior year, there are additional vaccines required for those 2 years. So 7th graders are required to have a booster dose of DTaP or DTaP and their first meningococcal vaccine. And then high school seniors are required to have a second meningococcal vaccine in order to stay in school.
Gotcha. And they're thinking about senior pictures and all that other kind of stuff. Vaccines are like really low on the list, I'm sure, of things. So you got to have those. All right. So if a student is enrolling for the very first time, let's say they just moved and they're in North Carolina schools, they're trying to acclimate to everything, they have to be able to show this vaccine list too.
Yeah. So they have to at least show that they're in progress. So if a student is new to North Carolina, never had vaccines before, coming in from out of the country even, we can take the shots that they had wherever they're from and enter those into our systems. But they do have to have a health assessment completed in North Carolina within a year of them being eligible to enroll in school. So if they're coming in, they've got to get that health assessment done, and it's got to be done by a North Carolina doctor within a year of them starting school. So if they came in late last spring and got one, that one will count. But if they haven't, they need to be seeking a physician or even looking at enrolling in the School Health Alliance or going to a urgent care to see if they can get a physical done first.
Okay. And so it may be hard to get into, your pediatrician's office or the doctor's office, that kind of thing. Is the health department one of the easy ways for people to be able to get those vaccines?
Yes, so definitely for vaccines and health assessments. Here in Forsyth County, we have a whole committee that's the Operation Zero Exclusion Initiative, where we aim to lower the amount of kids that are told they can't come to school after that 30th day. We have upcoming clinics as early as this Saturday, September 7th. We'll be here at the health department. The clinic runs from 9 to 1. And then on Tuesday, the 10th, and again on the 14th. We do require appointments for those, but you can call to schedule. Our appointment line is 336-703-4273 to schedule for that. And you can also reach out to the School Health Alliance if you're a student enrolled in Winston-Salem Forsyth County Schools. That is a provider that provides health services and health assessments to students only for Winston-Salem Forsyth County students.
Gotcha.
Again, their number is 336-703-4273, and the health department is 336-703-3324.
Okay, and so what we want you to know is while, she was just giving all the information and the phone numbers for Winston-Salem, Forsyth County, whatever county you live in, you need to contact your health department because they're going to probably be your best first stop if you need to get a vaccine and you need to get a vaccine quickly. Again, your health department wherever you are. All right, let's talk about this because every time that there's the start of the school year, kids get each other sick and then they bring it all home to the rest of us and we get sick too. There's that discussion. When do you let a kid go to school? When do you not have a kid go to school? What are the parameters there?
So a student shouldn't come to school if they've been running a fever, and they should be fever free for 24 hours without the use of any medication to reduce a fever. So no Tylenol, no Motrin. They should be without a fever for 24 hours. They should not have vomited in the last, if they vomited yesterday, they need to have at least not vomited overnight and been able to hold down food for breakfast before they come to school. And if they're having diarrhea, they shouldn't be having more than 2 stools more than normal in a day, or they should stay home from school. It's no secret that right now there's been a COVID uptick in this area also, just so that people are aware. It is going around again. If you've tested positive for COVID, as long as you've been fever free for 24 hours, you can return to school and or work. But the recommendation would be for you to wear a mask for 5 days after your positive test or your last fever.
Okay. All right. What we're going to do is we're going to take a quick break. We're taking your questions when we come back. 336-379-5775. We'll see you in just a few minutes.